Welcome to the Beauty Equation podcast, where beauty meets biology, psychology, and art history. This podcast is hosted by myself, Dr. Christelle Oliver-Dussault, Dr. Harpreet Lotay, and a beauty industry expert, Amanda Manholt. This is your space to reclaim agency over aging and beauty on your terms. We're cutting through the noise with evidence-based insights and real talk about aging, self-perception, and modern treatments. No quick fixes, no fluff. Just honest conversations to empower you to define beauty for yourself. Welcome back to the Beauty Equation. I'm Dr. Christelle Oliver-Dussault.
And I'm Dr. Harpreet Lotay.
And I'm Amanda Manholt.
So today we're talking about a specific group of women who haven't really had any treatments done before, who are a bit hesitant and are wondering, is this the right space for them? Are they behind? What's available to them? And anyone who's feeling a little bit intimidated or overwhelmed by the variety of options that we have to offer.
Or ashamed. I think that's the big one.
Yeah. We see a lot of that too. So let's start with you, Amanda, since you do so many consults and you get a lot of these, you have a lot of these conversations on a day-to-day basis. What are some of the biggest myths or fears that you would like to dispel?
So many, but the number one myth or the number one fear is that they're going to look fake. Today I had a lovely gal in for a consult and she was concerned that her forehead would look shiny and plastic. So it's that feeling like they look odd, like someone can point them out in a room and say, I know what you did. And I feel like that the underlying current for that is shame.
It is.
Right. And it depends. And I see it with, boomers and Gen X people like me, and even sometimes with the millennials, but the younger ones I find are sort of less averse. I feel like it's really these boomers and millennial or Generation X and
some of the older millennials.
Yeah.
The younger ones, I think, grew up with more of a social media presence that they don't seem as intimidated or bothered to talk about.
Not at all. It's like getting your nails done. It's something that they do for prevention, but their mums come in and let me tell you, it's a whole other conversation. And I think the thing that's so frustrating and challenging about aging is if you do nothing, oh God, she's let herself go. Ugh, look at her. And if you do too much, who does she think she is? Oh, she's one of those people. Oh, she must be vain. Who would do that? Right? So there's so much judgment or perception of judgment.
So what are some of the treatments that you'll often introduce to women who are coming into the clinic, who would like to have something done but are very hesitant and concerned? What are the most common things you'll usually find that they're open to or feel comfortable trying?
Well, skin health is foundational. So it's a friendly, approachable way to get them to start to understand that this is a very holistic thing, that one thing ties into the next. So I love it when I can review what they're using for their skin and give them some education and understanding about, things that will actually make a difference to their skin. I would say neuromodulators like Botox and Dysport, that's probably one of the first treatments. I don't know if you'd agree with that too, Harpreet, where it's not a huge investment in terms of money per se. And at the end of the day, if they don't like the results, guess what? It goes away and it's like you never had it. So I feel like that's I call it the gateway drug.
Yeah, right. Well, I think the fear, it's interesting that Botox, yes, definitely one of the first aesthetic treatments that will be introduced to women. And from a medical perspective, it's super, super safe. It's been around for decades and it's been used for treating medical conditions, migraines, spasticity in stroke victims even. So, but there's such...
Bladder.
Yes, overactive bladder. So many aspects in medicine we use Botox, and yet it's, considered the boogeyman, and you'll find all kinds of misinformation out there about how it's going to, change your brain. It's going to travel all over the place and give you botulinum, and, it's a toxin, which technically it is, but it's extremely, extremely safe. So I feel very comfortable as a physician recommending that, injecting that.
Mhm.
And it is, to Amanda's point, temporary. So that's very nice, because if people aren't loving the results, they don't have to worry. Everything about it is going to go away. So I love
I
that about
blame
it.
Those who are new to Botox, because there's a lot of confusion around the different injectables that we use. And I'm saying Botox not just for the brand, it's just
Yes.
what people commonly refer to.
Yeah.
How does it work?
Well, it basically stops your muscles from receiving the impulse from the nerves that tell the muscles to contract. So it stops contraction. That's all it does. And then your body's clearing mechanisms will go in and break down that protein and stop it from binding. That receptor will open up again and contraction will start again. So a lot of people will say, it magically erases wrinkles. All it does is it stops muscle activity, and it lets your skin repair itself from the micro trauma, from that repetitive creasing that you're creating, that you are not able to repair quickly anymore as you age. So it just stops muscle movement.
Yeah.
I totally blame Tim Allen. And what was that Christmas movie? He goes to the mall and he goes and apparently gets a Botox treatment, and then comes back and meets his family in the food fair, and his face like is all like
Yeah.
twisted up.
For
And I'm
those
like,
of you who are on the podcast, she's making a very funny face.
oh yeah, his face is all contorted and it's like looks ridiculous. And he's like,
Yeah.
I just got a Botox treatment, and I'm like, okay, come on. Like, first of all, it's probably the most anticlimactic thing you could ever do. It's literally a couple of pokes and you're on your way, and you don't really see a whole lot until it starts to take effect, somewhere between, depending on what you guys are using, 4 days to a week or so later.
Yeah.
But it's, this myth that's been perpetuated that you're going to look crazy or unnatural. And I have to say to people, I'm the winner in the clinic for number of units. Like, what am I at? 100 or what am I using, you guys?
119.
119, baby.
Yeah.
And I, and that was the comment with when I did the consult today. And she's like, I said, well, tell me what you're worried about. Tell me what what does it bad look like for you in terms of an outcome? And she said, I don't want a shiny forehead. I said, totally fine. I said, but just so you know, I'm the winner in the clinic, and
Is my forehead shiny?
Things still move, right? So yeah, unfortunately, there's just been a lot of misinformation, and it feels like fear mongering, and it just feels like putting us in our place. I'm sorry, I'm just going to say it. That's what it feels like to me.
Yeah.
Like, how dare you want to show up and be vibrant and still and be relevant, right?
Well, I mean, the interesting thing is women worry about whether or not they're vain. I don't think I've ever, in any context, I don't think I've ever had a man say, am I being vain? They own that. They're like, yeah, I care.
But
There
that's
was a commercial.
portrayed in the media and commented on our appearance constantly. Of course, we're going to then reflect on the way we look and appear if that's all we see.
Yes.
And popular media.
Well, and I think in our culture, it's a woman can never be too beautiful and a man can never be too strong.
Yeah.
I've heard it said. Do you remember there was a commercial years and years ago? And I want to say it was for Special K or some sort of cereal. And it was this guy sitting at a bar with a bit of a beer belly and crying into his beer about looking fat. And it was such a great commercial because it was just so, you're like, well, that's just ridiculous. Why was it ridiculous? Because it was a guy in a bar with a beer and a belly. I don't know.
So going back to our hesitant listeners, dipping your toe in often looks like a conversation around skin health, how it ages, and what is suited to your skin type, what will help, what will cause harm, and then introducing some neuromodulators. And that's a really lovely combination because, as Harpreet said, once it kicks in and your skin isn't moving as much or wrinkling or creasing like a piece of paper would, then those actives that we're using on our skin are starting to work. And it's a really nice symbiotic relationship. And
Absolutely.
usually, if you're going to be doing regular treatments, you should probably think about your daily skincare. The other thing I really love about Botox too, it's not just the effects that it has on the overlying skin, but it almost lets us play a little puppet game with people's faces. Particularly,
Mm-hmm.
I know last time, Harpreet, you talked about how I don't want my face to droop, the effects of gravity. And on the lower face, that's where I've really enjoyed exploring the use of neuromodulators, because you can get a real lifting effect and definition of the jawline there, which a lot of people aren't usually familiar with. So that's something that, if you were thinking it's just for your forehead, your frown, or the 11s, as people say, no, we have lots of uses that go way beyond just the upper third of your face that we can
Yeah,
use.
absolutely.
In
Yeah.
term, oh, go ahead, Amanda.
I was going to say, I think another thing that holds women back in particular is their spouse.
Oh, yes.
And I'm sure you guys can both talk about this, but it's like my partner can't know. It's kind of funny. I think a lot of times it's grocery cash that comes in. Again, it's just either they don't want to have to talk to their partner about it, or they don't want to feel guilty or the shame, or but that definitely comes in. That conversation is, had many times.
Well,
So
at the end of the day, I think what sometimes happens in those situations is that whatever the person in our chair is noticing does not impact the spouse. And what I mean by that is when the person looks in the mirror and they see that line and it makes them feel like they're old or they look angry, that affects that person, that woman
yes.
that's looking. And so she's seeking help for that feeling and that look that has nothing to do with her spouse or whether her spouse finds her attractive or not.
Mhm.
Because more often than not, the comment is, he thinks I look fine, but that's not the point, right?
Mhm. Yeah.
So, yeah.
And I think too, I mean, I've been married for, gosh, 25 years now. And, obviously we're both aging, but when I look at my husband, I don't tend to see a lot of that. He's just who he is
Mhm.
because we've been together so long. I remember going to, I think it was my 30-year high school reunion. Now that's a trip. And talking to a fellow that I literally did not recognize. I had to read his name tag. And then once I figured out who I was talking to, I was like, oh my gosh, Kelly. And the weird thing that happened is as I was talking to him, his beard sort of melted away, his weight sort of melted away. And as I heard his voice, he was like the 17-year-old person that I remembered. That was just an odd experience. So then I wonder, like, with your spouse, again, to your point, it shouldn't be it should never be for your partner. It should always be for you.
And I think from my experience, most people aren't coming in to do this for somebody else. They're coming in to do it for themselves.
Yeah.
And they just want to feel more confident. And they're coming into us to have a conversation because they don't know where to go and what is available and what can be done. We kind of touched on a little bit about the skincare, some of the injectables, which are neuromodulators. There's a few other injectables that we use, and I think a lot of people get confused with what that is. Harpreet, do you want to give a quick overview of what's available and when we might use it?
Neuromodulators come in different flavors, as Christelle mentioned. So those are those injectables that stop your muscles from moving. So those are great for addressing lines that are caused by movement or creasing. But there are other things that we can inject as well to address other aspects of aging. So one of the things that happens when we age is we lose volume. Our fat pads start to sort of get smaller in all the wrong places, like our cheeks, like our temples, and we start to get some jowling and softening of the jawline. So we can replace that volume with fillers that are made out of sugars. And we have these natural substances in our skin as well. It's called hyaluronic acid. But when we want to use them to create volume, they're sort of created in a way that gives them a little bit more substance. So we can use them to create a structure like effect. We can use them in thinner forms to soften certain lines. So they can be used in various ways. So fillers are, and those are what is injected into lips as well. And then we have yet other injectables that will address the loss of collagen that happens when as we age. So we lose about 1% of our collagen after the age of 20, and it just is this compounding thing,
Mhm.
snowballing thing that happens and decreases elasticity in our skin. And we can inject things like Sculptra, which is an injectable that will stimulate your fibroblast to make its own collagen. We have Radiesse, which also can be injected to do similar things as well as create a scaffolding for volume. So there are so many different injectables that
Mhm.
we use presently and other injectables coming down the road, like harvested adipose tissue that's sterilized and can be used down in the States. They use that. So, yeah.
Yeah. Have you too, you probably don't get it as often as I do, but when you're doing an initial consult with someone and they're just like, oh no, no injectables for me,
For sure.
which is totally fine. Um, if that happens, where do you tend to go?
Christelle, why don't you take that one?
Yeah, so oftentimes when people come into me, the conversation is usually around what they're noticing and what they want to address. And then if I notice any hesitancy, particularly with regard to like fillers, I'll dig it in to ask a little bit about like what are those fears, what worries you? And some are valid fears because still a very unregulated industry in certain parts of the world. And sometimes even we've noticed issues here too. And there can be complications if not injected properly. If so, I usually address those head on with them and tell them what the degree of risk is and what to expect. And also tell them, well, if this complications arises, this is how we manage it. So, for example, with fillers, one of the most worrisome, although very rare, is a vascular occlusion. So that's when the blood supply to the area near where you injected gets blocked. And that can either happen because the product has ended up in the blood vessel, if there's a big bruise pressing on that blood vessel. And we in our practice always give post-care sheets to our procedures with emergency contact numbers because if that happens, that is the one emergency we have to deal with. And we have a protocol on how to address that and break down and return blood flow to the area. So that's something that you should have a discussion with your provider if you're somewhere else and you're concerned. It's important to be aware about what the potential risks and complications are. And then if they arise, how's your provider going to manage those? Because if they know how to manage them, then or they have a protocol in place, then you're in safe hands, that they're aware of the risk of what they're doing and they also know how to address those issues. So I break down those fears, and sometimes it's still something that they're not interested in. And then we go to other tools. So injectables aren't our only tools. And I have patients who have medical conditions that prevent them from using filler type injectables. And then we might go to more medical devices. So we have microneedling, radiofrequency microneedling. We have various light-based therapies like BPL or lasers. So, Amanda, you'll often talk to our patients about that and link them in with our medical esthetician, Alyssa.
Mhm.
Do you want to maybe say a few words on those types of treatment and what people might expect to see with those?
Yeah, well, I think going back to the fact that great skin looks good, like it looks amazing on everybody, right? So I think there was a study done. We should find that picture and use it, but I know it's a twin study where
Oh, yeah.
the one that wore sunscreen, the one that didn't wear sunscreen, and or I think of some of our patients where we've done things like my favorite, which is the BBL Halo combination, where you've got somebody that, they lived a life they've had fun. They lived in the sun. And I mean,
Yeah.
gosh, when I was a kid, there was no sunscreen. So just improving the overall tone and texture of their skin with a treatment like that, I don't know, it makes them look less tired. It makes
Hmm.
them look more approachable. It makes them look more vibrant. So it doesn't always have to be injectables.
No.
No.
And I think that's, again, why skin health is just so impactful and foundational.
And
Yeah.
going back to the physiology of why wrinkles happen, right? It's because our skin loses the reparative capacity over time. So Botox, all we're doing is buying your skin time. So the other aspect of that equation is upregulating the skin's ability to repair itself using actives that we know uh, are medically effective, whether it be retinol or antioxidants, etc. Yeah.
Yeah. I think, so in terms of is it safe, I think, as you said, Harpreet, Botox is pretty darn safe. And I think, how do you determine if it's safe? And I love, hearing you both talk, and we'll parrot you really to say, it's been around. I think it's got to be close to 40 years now, Botox. Because I think I've been saying it's been over so many years, and I've been saying that for the last 10 years. So as physicians, I would assume that that's one thing that helps you feel safe and comfortable using a product if there's been umpteen million treatments.
So many studies on Botox.
Yeah,
Studies
many.
and
That's it. It was actually Dr. Jean Carruthers, who's based in Vancouver, who first discovered it with her husband when they were treating someone for blepharospasm, which is a spasm of your lower eyelid. And she noticed, their wrinkles are getting better on their eyes.
yeah,
So,
see, it just needed a smart lady.
exactly.
Yeah.
So it has been tried and tested and used. And the bigger numbers we have and the more information we have in terms of potential side effects, the more comfortable we feel, because then we know how to deal with something if it goes wrong.
And I think too, Christelle, with you having worked in the UK, there are some real challenges over
Ireland,
there.
it's different to the UK.
Sorry, right?
Just for all the
God,
Irish listeners out there who are about to get riled up, sorry.
thank you
I
for
did train in the
clarifying.
UK though, so it is confusing. I
Okay,
did
you
my initial
trained in the
aesthetic
UK.
training in London, but my aesthetic practice was in Ireland.
So in Ireland, because I am aware that there are some real challenges in the UK with, is it the same in Ireland where things like dermal filler have been categorized as a device? Is that how you
Yeah, it
explained
was
it
a
to me?
similar issue, and there's been huge talks. They actually, RT is the main news station, and they recently did a series on this and the safety. And there's now a new aesthetic board in Ireland who is overseeing and trying to establish guidelines around safety. Last year, there were some products that had been brought in through the north that we don't really know what they were.
Oh dear.
Yeah, so there's been issues, and I think that's not just the UK and Ireland. There's been a few areas. So in terms of safety for the public, go to someone who's licensed. So we have a licensing body, myself and Dr. Lotay, where we are registered. We have to show that we have continuing medical education for this special interest area that we've developed. We have to publish our licensing authority in our clinic, and it's there. If you're at a clinic and you want to know who's injecting you and you don't see a sign, just ask the front desk. They'll be more than happy to show you. So that's a good little safety nugget that you can put in place.
And my advice is if you have a consultation with someone who is there to inject your face and you think they look really weird, run, don't walk as fast as you can out the door, because everybody's perception of beauty is a little bit different. And there is a lot of dysmorphia in this industry, not only with patients, but I think also it's with providers. Let's be
Yeah.
real. We've all been to conference.
Yes.
Yeah. And
Yeah.
I would like to add that, make sure you're being injected in a clinical setting and it's not, a conjoint party or something like that where you can't guarantee sterility and so on and so forth.
Yeah. And make sure that it's legitimate product. There's always ways for people to get their hands on things. And unfortunately, we even had a situation where we are, where, the woman was charged. She was making claims about her credentials that were untrue. And that was really upsetting for the people that had had treatments. They felt ashamed, they felt embarrassed. And here's the thing that's crazy to me is if something had happened that had been terrible, like she doesn't have a governing body.
No.
There's no
No.
accountability.
No.
So yes.
So generally speaking, I would say aesthetics is very safe. We use products that have been studied for decades, and in the right hands and the right credentialed people, it's quite safe.
Mhm.
So yes, it's safe,
But
and no, it's not vain. I don't think.
it's not vain. It's safe if you still have to be careful, I think. And I
Yes.
think that was part of the reason why we wanted to do this, is so that the listener, the listener, has the tools to assess whether it's safe. So if the price is too good to be true,
Yes.
that is a bit of a red flag. If there isn't any licensing body, that is a bit of a red flag. If the place doesn't seem clean, I think that's just a no-brainer. It's a medical
Yeah.
procedure. Their provider should be washing their hands and putting on gloves, and the rooms are cleaned after every person. So
Yeah.
just common sense stuff like that. And then, like, to your point, Amanda, if you like the appearance and the aesthetic of someone who's injecting you, then you probably have a similar view to what beauty is.
Mhm.
Making
And
sure that you feel
to
heard.
each their own.
And to each their own. And just make sure you feel heard when you're talking to your
Mhm.
provider. If you feel like they're not understanding you, don't have real pressure to get a treatment on the day. So
Absolutely.
I
Yeah.
think, yeah, there's probably a lot more that we could go on about this topic, but I think
Oops.
we've lost Amanda.
Oh,
Oh, am I back?
You are back.
Okay.
yeah.
I was going to say that the other thing that I really value with both of you is that there isn't this pressure to bring in the latest thing.
Mm,
It's very much, there's a lot of critical thinking that goes into it, because I think it's very easy to get caught up into marketing hoorah rah
right.
about the newest, the latest, the greatest. I really respect the fact that there's critical thinking about, okay, well, does this make sense? Does this resonate with what I want to do or what you want to do as physicians, right?
Mhm.
Mhm. To
Because
me,
there's
the questions I always ask are like, okay, well, what were the side effects in the study? What went wrong?
And I
yeah.
like to wait till it's been out a bit so other people can experience those
Yes,
mistakes,
Share
not
the
me.
good, tell them how to quit.
exactly.
Yeah, and, it is a industry that is impacted tremendously by marketing, and there are always products coming out that don't stand the test of time and don't stand up to critical scrutiny when you come and look at the data. So it is important to insist on that scientific rigor, I think.
Yeah. So to everyone listening today, thank you for
Yes.
tuning in. If you have questions on today's episode, you can send us an email at info@thebeautyproject.com, or as if you're watching, put a few comments below. We always love to hear
Yes.
from you, and we will see you or chat to you soon.
Bye for
Bye-bye.
now.
Before we wrap up, just a quick reminder. While we're medical professionals, everything shared on the Beauty Equation is for informational purposes only and isn't intended as medical advice. This podcast doesn't establish a doctor-patient relationship, and any medical or aesthetic decision should always be made with a qualified healthcare provider. Our views are our own and don't necessarily reflect those of our employers or affiliated organizations. And remember, the field of aesthetics is always evolving, so information may change over time. See you next time on The Beauty Equation.
Thank you for tuning in today. If you enjoyed today's episode, don't forget to like, comment, and share it with someone who might need to hear it too. We'd love to hear your thoughts or questions. You can send us an email at info@thebeautyequation.com, and you might hear your question answered in future episodes. You can also find us on Instagram at Dr. Christelle MD, at H. Lotay MD, and at Crow's Feet and Confidence. Until next time, keep questioning the equation.